Good evening and welcome everybody. Thank you for joining us tonight on the 6th of July for our second webinar in the series with F10 on treatment applications in Herptile patients. I am joined tonight by Dr. Kevin Eatwell, Dr. Dorianne Elliott, and our host for the evening, Dr. Neil Forbes. So let's just sit back and enjoy a quick holding slides video to show you how to use the platform and how you can engage with your panelists and with one another. So you're welcome to start chatting. Let us know where you are from, if you are keeping safe, and just keep on networking in the chat room. thank you all for your attention. And with that now done and dusted, I have the pleasure of introducing your host for tonight, and that is Dr. Neil Forbes, who is based in the UK, and even though his heart actually belongs to Africa, he spends as much time here as possible giving his time and expertise freely to causes such as vulture conservation and the training of vets in avian orthopedic techniques. He is a diplomat of the European College of Zoological Medicine and a recognized specialist in avian medicine. Teaching is a second nature for Neil, and he has lectured internationally for many years and has contributed to more than 65 peer-reviewed papers and over 38 books. Even though he refuses that we go on too much about his impressive career and all his accomplishments and contribution to the veterinary profession, he prefers to be called retired, but we beg to differ. We all know that specialists don't ever retire from full-time clinical work, and Neil nowadays keeps busy with consultancy work revolving around zoo, local authority and welfare inspections, and also training and teaching. He is involved with expert witness roles, captive breeding and conservation projects such as the Hubara bustards and critically endangered species of vulture. He is also the veterinary advisor to health and hygiene, and we are very privileged to have him and the other panel experts tonight with us to share their knowledge and experiences with us. I'm going to hand over to Dr. Neil to introduce his colleagues for the evening.
Thank you very much indeed, Corné. Very kind introduction, and thank you for organising this, and thank you to the South African Veterinary Association and, of course, to Health and Hygiene and all the team there. It really is a fantastic pleasure and an honour to be talking to you all tonight, and I hope you'll find this presentation useful. If I could introduce my two colleagues first of all, and I'm really excited to have these two great experts here with us today, because they share an absolute wealth of knowledge and experience. So in alphabetical order, I'll introduce first Dr. Kevin Eatwell. He gained his Bachelor of Veterinary Science. He also has a certificate in zoological medicine, and he's a diplomat of the European College of Zoological Medicine. And what makes that really unusual is most people are just a diplomat in one subject, but Kevin's a special guy. He's a diplomat in herpetology, and also in small mammals. So he's a real special, clever person in that respect. And he also has the Royal College of Veterinary Surgeons Diplomat in Zoological Medicine. He has a fellowship in FHEA, or Kevin will tell you what that is later. Education. Okay, so that's, as a teacher in UK universities, that's one of these things that you have to do. And Kevin is also a Royal College of Veterinary Surgeon specialist in zoo and wildlife medicine, and a European recognised specialist in herpetology. But Kevin started off his career in mixed practice, and I always think for those people in academia, actually to start life in practice is a really good grounding. It means you know what side your bread is buttered and so on. So he during that period he developed a clientele with exotic pets, gained his certificate in zoological medicine in 2001, and subsequently his time was spent working for wildlife hospitals, zoological collections, and commercial clinical pathology laboratories and exotic pet practices. He gained his diploma in zoological medicine in 2006, taking reptilian species as his specialist paper. He became an RCBS recognised specialist in zoo and wildlife medicine in 2007, and he became a herpetological diplomat and recognised veterinary specialist of the European College in 2009. In 2013, he became a small mammal diplomat of ECZM. He has lectured internationally about exotic animal species and is widely published. He joined the Royal Dick, that's the Edinburgh Vet School in the UK, in 2008. So as I pointed out to him before we started, he's been there 13 years. Lucky for some, maybe not so for others. But anyway, he's enjoyed it and he's sticking there. So he works there as a senior lecturer in exotic animal and wildlife medicine, and he leads the clinical team of the Dick Vet, Rabbit and Exotic Animal Clinic. So welcome, Kevin. Fantastic to have you with us. And then our second guest is Dorianne Elliott. Needs very little introduction to South African colleagues who have joined us. Welcome, everybody. Dorianne qualified initially as a veterinary nurse. So again, that means that Dorianne's got a very well-grounded background and lots of knowledge from the nursing and patient care side, as well as the the veterinary surgeon side. So she graduated as a veterinary nurse from the University of Pretoria in '95, went on to study veterinary science at the Faculty of Veterinary Science at Onderstepoort. She obtained her BVSc in 2002, and her passion for exotic species led her to the private bird and exotic animal hospital at Onderstepoort. So those of you who aren't aware, this is a privately owned exotic clinic and service within the university. So Dorianne owns and runs that clinical service and is also involved in student training. And as such, of course, very many graduates of Onderstepoort will be familiar with Dorianne. She's passionate about educating vets as well as the public in the proper care of exotic animals. And apart from her interest in herptiles, and I can tell you, having worked with Dorianne a bit on various projects and been in her clinic, anything that gets injured or is sick or doesn't have an owner, it goes home to Auntie Dorianne. So she's got a real menagerie at home. She has a great interest in falconry, a particular passion for rehabilitation of birds of prey, and also in getting rehabilitated birds fit again and hunting before they're released back to the wild. So welcome both of you. Really good to have you both here with us. So we're going to carry on through the presentation. I'm going to present some of it. Dorianne will do some, Kevin will do some. We'll have a chat about everything, and we'll have some polling going on. So guys, don't go to sleep, please, because we're going to be asking you questions just to make sure you've been awake. Okay, so it gives me great pleasure to introduce F10 in respect of the care of birds, the care of herptile patients, not only as a clinician who's used F10 myself for more than 20 years, but also I'm delighted now to say I'm the veterinary advisor for health and hygiene. So what makes F10 different? Well, basically, we have safety testing of all finished products by government accredited quality controlled laboratories for skin, oral, dermal, and inhalation safety. A lot of other products, they have test certificates for the each individual ingredient, but not for the tested end product. We also have efficacy testing of all finished products, again, by government accredited quality controlled laboratories. And there's a considerable amount of information, not only testimonials, but also safety, efficacy, data, and all the application instructions are much, much more available on the website. So again, just to make the point, Health and Hygiene, who manufacture F10, believe in sharing the facts, the evidence with you, not hiding it and telling you something that's not quite believable. So all the test results, full details of dilution rates and contact times, and the application guidelines are all provided on the Health and Hygiene website. So Health and Hygiene Products provides added value to all products across its range, with training and education of distributors, clients, and users with this and similar presentations, together with a comprehensive fact-packed website. And just before I go any further, I'm just going to very quickly go back to the first page, because I should have said to you, anyone who is not an English speaker, if you go to the YouTube link after tomorrow, this presentation will be on the Health and Hygiene YouTube site, and there is a simultaneous translation facility on that page. Okay, so we're going to go and look at individual reptile cases. These are all cases that, or the ones I'm going to talk about, are ones that I've dealt with in practice. So for many years, I was head of a 5-clinician exotic referral service in the UK, running 24 hours a day, 7 days a week, every day of the year, dealing with all exotic patients. So we're just going to start looking at mouth rot. Mouth rot is a common and serious disease in steaks, commonly caused by Pseudomonas and Aeromonas, but of course there can be other pathogens there as well. It is important to use imaging to make sure that there isn't invasive infection, osteomyelitis that you aren't necessarily aware of without doing the imaging. Always important and essential to swab for culture and sensitivity. And one of the great points here is that reptiles get sick slowly, they get better slowly. That means if you don't give them the right drug to control the infection, you may not be aware of it for several weeks. And that's why it's really, really important to always do your culture and sensitivity, so that even if you start one drug, you can quickly change to another if you've chosen the wrong antibiotic to be using. So with these cases, we would remove any necrotic or caseous material and spray the mouth 2 to 3 times a day with F10 SC at 1 in 250 dilution, pending the laboratory results. And once we start the antibiotic therapy, which is likely to be necessary, then of course we can still maintain the F10 as a continuing treatment anyway.
I would add, if I could, when you're swabbing for culture, it's quite important to make sure you get air modes and fungal culture as well, just because reptiles love to get a whole variety of stuff in these lesions. So it's just not your standard culture and sensitivity. Culture everything and see what comes out.
That's a very good point, Kevin. Thank you very much. And I think, you know, these little tips, and that's really why we have this group of experts here to talk to you, is sharing the tips and tricks that we have learnt over the years. And that's just really so important. You know, you think about a cat or a dog, you just do bacteriology, but actually with herps, you've really got to go the whole hog. So thank you for that comment. Okay, so moving on to thinking about tortoises. Of course, stomatitis in Chelonia is a very common problem. Again, frequently there is an Ehrlichia or Pseudomonas infection, but equally we commonly see Chelonia Herpes Virus and also Mycoplasma. So they can cause runny nose syndrome, but also they can cause a stomatitis. So taking a sample and getting a PCR test for Chelonia Herpes Virus and Mycoplasma is important. Again, culture, bacteriology, and fungal culture, really important as well. And in the meantime, pending the results of those tests, again, flushing the mouth daily, 2 to 3 times a day with F10 SC 1 in 250 washes is certainly very useful. Okay, so the next case we're going to look at is lizards. And just mentioning peri-oral surface wounds, and just an important point here, that if the wound is only affecting the surface, then it is absolutely appropriate to be using the F10 Germicidal Barrier Ointment. And the great advantage of this, because it's an ointment, it's sticky, it stays there, it keeps the surface moist, and you get a maintained germicidal action for at least 48 hours. So that's really, really handy. But do be aware, if you've got a lesion that is subdermal, then the ointment will actually cause a delay in tissue healing. Now, we'll talk a little bit more about that later on, and Kevin and I may have a discussion about that, but it's something you must be aware of and not use the ointment in that scenario unless you don't have an alternative option, because the animal is difficult to access on a regular basis. So with these, we would normally, with a deeper lesion, we'd be recommending again F10 SC 1 in 250, 2 to 3 times daily flushing. Obviously, you debride these lesions, you take your culture and sensitivity, and then, of course, treat them pending any results. Moving on to think about ear abscesses, a common problem in a range of reptiles here. So the top image, we can see a tortoise. I expect you to see my mouse here. So we've got a swelling over the ear canal here. And so what we'd be doing here is you putting a little bit of local anesthetic in to the skin and under the skin, lancing that swelling, draining and curetting the ear canal. Again, obviously collecting a sample, and remember, you collect the sample from the interface between the tissue and the caseous necrotic material. Don't take a swab right from the middle of the caseous rubbish, but from the edge of the tissue. Get that culture running, as Kevin said before, a broad range of tests there. And so long as only the tissue, the surface tissue is affected, again, we can use the F10 Germicidal Barrier Cream. We can actually pack the ear canal with that. And you may think, well, that's thick and it's going to stick in there and it's going to cause a problem. But of course, the ointment in F10 barrier cream is lanolin, it's sheep oil. And as soon as it gets raised to body temperature, and okay, with the reptile, that's not as much as a mammal, but basically it liquefies and does drain away. So it doesn't cause a blockage and cause an issue there, but it does give you that prolonged anti-bacterial, antifungal, antiviral activity pending the result of your culture and sensitivity. And we'll just touch on a skin case here. So dermatophytosis, common problem in reptiles and can be really, really difficult to treat. And of course, the issue is the lower body temperature, the poor blood supply, etc., etc. So on the right-hand side, you can see a uromastic with a chronic fungal dermatitis. And below, we can see a spiny-tailed iguana with tail necrosis. And in both these situations, what we'll be suggesting is bathing the patient daily for 15 minutes in F10 SC 1 in 250 dilution for a 45-day period. Remember, everything has to be done for a long time with reptiles. And then touching on autonomy, I expect that a lot of you who are watching are aware that autonomy is a predator escape mechanism. So we see it in iguanas, but also a whole range of other lizards where basically if they're getting chased, if someone grabs their tail, they will shed their tail. And as a clinician, it's very tempting to, you can see a cross section through a tail there where the iguana has lost the tail. Very tempting to grab the sides of the wound and pull them together to reduce the surface area to hopefully allow it to heal more quickly. But of course, if you do that, then granulation, skin closure will be affected and it won't work as well. So don't try and close it, leave it as it is, but spray it or bath daily, again with F10 SC 1 in 250, at least twice a day to control any infection. Okay, now at this point, I'm going to hand over to Kevin. He has a particular interest in reptile respiratory cases, and as he'll explain, they're a particular problem and challenging to deal with.
Thank you, Neil. I would just say with the autotomy thing, just before we finish on that, I think it is important to check out which species do regrow tails and which species don't, because obviously that does influence your management, directly on those. So I guess the species iguanids and the geckos are going to be the ones that we're going to see where they will do autotomy, whereas the agamids won't. So if you're not sure, check your species as to whether you want to suture it or not. So I guess moving on to respiratory infections, I mean, we see a vast quantity of different respiratory infections across all the species, really. And you can get quite serious debilitating disease developing before the owners actually recognize it or present them to you. And equally, you may be in a situation that you can get a wide range of pathogens, as we said in here, ranging from fungal disease through to a variety of bacteria or viral diseases present. So when you're first seeing these and you're pending maybe culture results or you're pending PCR results to come back, you kind of need something to start the ball rolling, if that makes sense, to cover that base. And the F10 is a brilliant product to use in those circumstances because of its wide spectrum of activity. It's going to cover a lot of the potential pathogens that we would see in these cases in the absence of a diagnosis. And I think what Neil's also said with the F10, for me, when we're looking at these, is I want something that is not going to irritate mucous membranes, is not going to cause damage when you're inhaling this into an air sac, etc., etc. So having the safety studies that say this is okay to nebulize, obviously, is a great help. So for me, the F10 would be a standard starting point for any reptile showing signs of respiratory disease across all the species, really. And we're using 1 in 250 dilution of the F10 SC, and we're probably doing 30 minutes twice a day on that, and that would be fairly standard for what we would do for that. Do you want to go on to the next slide, Neil? I mean, I'm dealing more with individual pets than ranch reptiles, but again, we've got that same scenario. If we're using the F10 as an individual treatment. If we're dealing with outbreaks in groups or collections of reptiles, again, you may be pending post-mortem results, you may be pending culture results, things like that. You do then need something to treat everybody, and there is an element here as well of what can I treat in the environment, and this really where I guess we moves into fogging of that environment alongside not just nebulizing the individual patients now to control pathogens in the environment through sort of contact with the surfaces. So when we're looking at things like herpes virus, or we're looking at things like Mycoplasma, then yes, we want to get things to the environment to be controlled. And as much as we want to have ideally a kitchen clean environment where you've removed organic debris before you start disinfecting, that can be quite difficult to achieve in complex enclosures and setups, or with large animals being transported around and things. So fogging is a very easy way to try and limit transmission of disease, and it's a twofold action really, I guess, Neil, isn't it? It's the antibacterial action, but it's also going to trap dry particles and make them fall to the floor, basically. So it's going to stop the aerosolization of material between patients as well, which obviously is also going to help. So F10 is something that we would be routinely using as a treatment, but also you want to fog it and damp every bit of dust and everything from your enclosure and setup before you clean them out and move animals around, basically.
Yeah, so I think as Kevin has touched on there, but it's so important, and really this issue about importation of tortoises, very often these are ranch farmed, and literally certainly they will get shipped to the UK in boxes of 100 and 150 tortoises per box. So you only need one tortoise in that whole box to be carrying either Mycoplasma or Chelonia Herpes Virus, and all of them are likely to get it. So for us, the whole take-home message is don't wait to have sick tortoises. Fog the airspace that the tortoises are in before there's an issue. So before they leave the breeding farm, during transportation, when they arrive, and of course there should be, and this is where the veterinary profession has a really important role to play, there should be a proper quarantine process rather than, as normally happens, 150 tortoises, you'll find probably half of them are sold before the day they arrived. And literally, as soon as you open the box, they are being shipped off left, right, and center, very often into homes where they have other tortoises that will be susceptible to the infections they bring with them. So managing these situations is really important. And one thing I want to just pick up there, Kevin mentioned that the great thing about F10 is it's so safe. We've got all this safety data. Those of you who are here for the avian treatment webinar, which we gave last month, will already know this, so I apologize to you. But I recounted cases where I had two particular cases. I had birds that were suffering from a fungal conjunctivitis. Now, certainly for us in the UK, there is no proprietary antifungal eye drop available. You have to get them made. It takes weeks and it's very, very expensive. And yet, because I knew F10 so well, I knew that F10 diluted, dropped onto the cornea, does not cause corneal irritation. And hey presto, treating birds with fungal conjunctivitis, within 48 hours, they were clinically normal. Treated them for 5 days and everything okay. So again, it just shows how safe they are. And again, we know that both not only for the patient, but also staff walking through the environment, of course, it's safe for the staff, it's safe for the patient. And as Kevin rightly said, it not only treats the patient, but it cleans the air. The droplets in the airspace grab hold of the pathogens and take them to the floor, and they neutralize them when they hit the floor and come into contact with the F10 as well. Okay, so let's just move on there. What have we got next? Yeah, well, I think that the next point I wanted to raise really is just don't forget infection control and biosecurity. I know we've just touched on it there a little bit. And whilst we've been discussing ill patients and individual patient treatments, remember that actually F10's greatest function is to prevent infection and to maintain biosecurity. And of course, one of the great things there is that we can use routine, regular fogging, as Kevin said, improving air quality by reducing suspended infectious particles, as well as sanitizing the patient's upper respiratory tract and reaching all the surfaces in the clinical space. And of course, the great thing about F10, the reason why we can do that is because F10 does not corrode metal, and fogging machines have metal parts in the nozzles, so other disinfectants you can't use, but F10 we can use in that situation. And remember, of course, you've got to sanitize the area with a frequency proportionate to the level and the risk of contagious infection. And so a ward area or a reception area, a consulting room area, which is at a high risk, you'll probably want to be doing a deep clean once a week. But remember, you must remove the lipid surface layer. That's the little fat layer on the surface that traps the pathogen. So you must use the F919SC biofilm remover to remove that lipid surface layer as well.
If I could add Neil, in at this point, thinking about infection control in the environment, I mean, you'll have lots of, I guess, competing products saying, here's a list of things that I will kill in your environment, which I guess we're just getting to now. And that's all very well and good, but the issue here is, you know, if you've got the circumstance where you are emptying out that room completely, then you don't have to necessarily worry so much about the safety, but you've got exposure to the people actually doing the cleaning. So a lot of the products out there that people go, oh yeah, I use this, it's brilliant. And it's like, yeah, it might be brilliant and it might do all of those things, but do you really want to be inhaling that yourself? Do you really want to have it on your hands? And if you've got livestock animals in that room, do you really want them to be exposed to it? So, you know, you've got to look at, there's a balancing act here when we're dealing with animals between just getting something that we know is effective, that's going to have an effective kill, versus can I use it in the presence of animals? Is it non-irritant? Is it not going to upset them and me in the process of doing that? And that's where F10 excels in this setup compared to other products.
Great, thanks, Kevin. And I think the other point there I'd like to raise, and this all comes back to us sharing with you the independent product test results. And just to stress, you know, if you're using another product, don't just take it as gospel what they tell you it works against. There's one product that's very widely used in many parts of Europe, and they say, oh yes, it passes all the tests, and yet even if you look at their own website, you find that actually when it comes to the Pseudomonas test, it fails. It should be to meet the pass level, it should be a log to the power 5 kill, and it doesn't. So don't just believe what you're told. You must take the time and actually check the efficacy data. And the other thing I want to really to stress to you also, so often I go to, whether it be boarding kennels, pet shops, veterinary practices, and I say to people who are involved in doing the cleaning is, firstly, do you know what dilution it should be at the ambient temperature that you're doing your cleaning with? And what is the contact time for the most relevant pathogen that you're looking at? And I'll guarantee 95% of people do not know what the contact time should be. And what you have to think about is the contact time for that product realistic in the situation you're dealing with? Let's take a consulting room table. You remember a 2-step clean, so you clean it down with warm soapy water, then you treat it with disinfectant, but you then are probably going to need 5, 10, 15-minute contact time for it to be efficacious. Is that realistic? Or actually, should you be using 2 consulting rooms, use one, clean the table, use the second one, and then come back to the first one afterwards? So it really is important to go into these things with your eyes open and ask the questions, study the data sheets, and see, is the product that you're using really as good as it needs to be and as good as you're told it is? Anyway, we digress, so we must go back. I just wanted to point out on this slide here the significant infectious diseases that herps commonly suffer from that are controlled by F10. So Rhabdarinovirus, Chelonia Herpes Virus, Paramyxovirus, Ranavirus, and Chytridiomycosis, and of course many, many more in terms of viruses. And then the next line, the ones in yellow, I put them in yellow to stress to you, these are zoonotic infections. And that's really important. I'll come to that again at the bottom of this slide. So Salmonella, Mycobacterium, E. coli, Campylobacter, Pseudomonas, Eromonas, Klebsiella, and Dermatophytosis congolensis. So just some examples. Obviously, there are many, many more, but these are common pathogens in reptiles. And then we have the dermatophytes, so we have Aspergillus, Mucor, Candida albicans, Fusarium, and Cryptococcus, Cresciporium, and other fungi as well. But the take-home message is, remember, the commonest type of pet to be kept in a bedroom, and it's typically a child's bedroom, is a reptile. You know, it beggars belief, but you think, you know, these reptiles more commonly carry zoonotic infection than other pets. And yet you're happy for your child to go to sleep breathing in the air that's disseminated from their reptile in their bedroom. Okay, they're keeping it in their bedroom because you don't want it in the rest of the house. But is it really safe? Alternatively, you may have snakes. You know, many snake keepers have racks of snakes with many snakes, 50, 100, 200, 300 snakes in one room. And of course, a high risk of the transfer of contagious infection from one to another. And so infection control and biosecurity is so important. And as veterinary clinicians, we shouldn't be just treating sick animals. We should be stopping and taking the time to say to that breeder or that hobbyist or that enthusiast, you know, how do you manage your snakes? Would you like me to come to your premises sometime and give you some advice as to how we can control infection and limit the spread of infection within your environment? Because whilst a lot of reptile keepers are very knowledgeable, there's still an awful lot where sadly the important things are being missed. So if we move on to different cases now, and I just want to touch on coelomaitis. Obviously, we all know as clinicians, a lot of reptiles suffer from follicular stasis. So this isn't egg binding, this is follicular stasis. So we have a whole lot of, a bunch of grapes basically, and pretty well any female reptile, unless she's got good habitat provided so that she can lay eggs, even in the absence of a male, she will develop follicles on her ovary, and if she can lay eggs, she will lay eggs. But if she hasn't got the opportunity to lay eggs, those follicles will just sit on her ovary. And some people think that it's follicular stasis that makes them sick. And generally speaking, it's not. Generally speaking, they reach a point where one of those follicles ruptures and we get scrambled egg throughout the coelom, with what you might think of as the peritoneal cavity. And there you end up with a toxic patient. And of course, we need to do surgery to remove the follicles, but also we can flush out that coelom. So we would flush out using F10 FC 1 to 500 in saline, not in water, but in saline. We would use warm saline as well, so it's at body temperature. We would flush it, the coelom, several times, obviously being careful to make sure that the lung was intact first to make sure we're not going to cause any issues, but flushing that out several times. And then once we've done that, we can flush out again with just clear saline, and then close the abdomen, putting some antibiotics in there if necessary. But not only getting rid of the pathogen load, but also the fibrin to reduce the risk of adhesions following the surgery is really useful. Kevin and Dorianne, is that something that you guys have done? Are you happy with that? You found it useful?
That's not something I've used personally in that setting, Neil, but I agree. It's that sort of thing of, is it safe in tissue, and we nebulize with it? So yeah, no reason why not. Yeah, absolutely.
Yeah. I've certainly used it. Go on, Darren.
No, I've used it several times. I've also used it in mammals.
Yeah.
And I've never had any inflammatory reactions. It's always been great.
Absolutely. And likewise, I've done exactly the same, particularly where you've got a septic peritoneum, then, you've really got nothing to lose. But to be honest, it's worked for me really, really well. I've never had an adverse outcome, and the patient has always done well. So I really would recommend that to people who haven't tried that themselves. Okay, Dorianne.
we should add it sterile saline, isn't it?
Yes, of course. Yeah, thank you. So, Dorianne, can I hand over to you at this point?
Yes, thank you. All right, so we see a lot of Chelonia Carapace traumas. Most of the animals that we see are wild tortoises that have been hit by cars on roads and things like that. But we also see a lot of dog bite injuries. Okay. And I always say to people that dogs think tortoises are hamburgers. You know, there's no way you can safely keep a dog and a tortoise together without them being supervised. So anyway, it obviously depends very much on the position and the severity of the trauma, as well as, you know, have the sides of the carapace been gnawed, or is there actually a penetrating injury? The lungs of the Chelonians, the tortoise family, lie in the dorsal third of the carapace. So a bite wound to the top of the shell will often penetrate the lungs. And one has to be very careful. The first thing you want to do with a bite wound, of course, is to flush it. But one has to be very, very careful to make sure that you're not going to end up flushing into a lung, for example. All right. Ideally, culture and sensitivity. And the salami cavity can be flushed with F10. I see, Neil, you guys are recommending 1 in 500 here. Could we go to the next slide, please?
Sorry. 1 in 250 is probably absolutely fine, but I was just playing a little bit cautious on that one. So anyway, this is onto your case, Dorianne.
Thank you very much. All right, this is a very rewarding case that we treated over several years. The tortoise's name ended up being Curvy Lady, and she was we'll call her a pet tortoise, but she was illegally kept, so we ended up adopting her. Firstly, because of the fact that the owner didn't have a permit, and secondly, because the owner had no interest in treating this case. A car drove right over her and damaged this very large portion of the shell, which actually had to be removed. You can see it's completely devitalized there. Next slide, please. Oh, I can do that. Okay. All right. So luckily, she was presented very, very soon after the injury. We removed that devitalized portion of the carapace. The lung was penetrated in several places. All right. So we did flush with F10, but what we did is we held the tortoise upside down in dorsal recumbency so that we managed to flush the more superficial areas of the injury without the risk of the F10 actually running into the lung parenchyma. We started this animal obviously on aggressive analgesia, which was meloxicam and butorphanol. And what we did is we managed this entire situation pretty much just with F10 SC. What we started out by doing was we took gauze swabs, we soaked them in the F10 SC 1 in 250, and we used them as wet-to-wet dressings. We changed them daily. So basically all we did is we packed that entire defect with gauze swabs wet with F10. We then elastoplastered over that whole area, just to keep out, you know, dust and flies and things like that, and to keep our swabs in place. We changed that daily in the beginning. When we started to get dying tissue and necrotic tissue coming away, we changed from wet to wet to dry dressings, changed every third day or so. That assisted us in the debridement. Initially, in a case like this, you will start, the animal will start to form a granulation bed, all right? And then that granulation bed with time actually starts to become hard, fibrous, and then very, very slowly over a period of a year, that fibrous layer actually becomes hard. It becomes horny again. Let's see here. There we go. All right. Now, what we did for her in the longer term is we actually made a false carapace out of casting tape being the tape that is used to make arm casts on humans, the artificial plastic stuff that you wet. Anyway, so what we did is we wrapped it round and round her so that we had a perfect mold, and then we cut that that cast through the ventral midline. So we had basically a clamshell, and we then removed it every time we needed to treat the wound, and we popped it back on and laced it with wire under the belly, under the plastron, and kept her like that. Several reasons for this. Obviously, in our hot climate, lots of flies. But also, even when that area healed, it was still depressed. And because it was facing upwards, we were very concerned that we would get, especially in the rainy season, you'd actually get water pooling in that area, which I think would have been, potentially deleterious to the whole thing. All right, so in the later stages, we actually packed the wound just with dry swabs once it had become fibrous, okay? And then we would just take that shell cover off, repack the wound, make sure we weren't dealing with any secondary infection, and put it back on. Now, this is 6 months post initial presentation. The defect has formed a horny layer. We discussed the water pooling. And so that tortoise ended up wearing that hard cover long term. She was unfortunately lost to follow up about 3 years post. But this is 12 months post injury, and you can see that the area has now formed a horny layer, and it's actually even starting to form pigment. All right, so and a very, very rewarding outcome of that case.
Great, thanks, Dorianne, for sharing that one with us. And it's just amazing. We know that reptiles are so susceptible to infection, and you see the severity of that wound and the fact the car's driven over it, and yet any contamination infection was simply controlled with F10. I'm not surprised, but I'm just making the point that that was there. And as we said before, just using F10 SC 1 in 250 in saline, so a wet to wet, not using the ointment, but not pressing granulation and so on, but worked really, really well. I just want to throw to Dorianne and Kevin now. I mean, obviously, again, we've dealt with many of these tortoise injuries, again, chewed by dogs or run over by grass cut lawnmowers or whatever. And my approach has always been, as Dorianne would, I appreciate Dorianne's injury there was very, very severe and very large. But what we've done in the past, and often with some big deficits, is managed everything with wet to wet dry dressings and then wet to dry dressings, probably for 2 to 3 weeks, that sort of period. If there is a big deficit, if they've been chewed and the skin can actually be closed up to the carapace or the plastron, we would do that, and then overlaying it with either the fiberglass or with human dental acrylic, and just left that on, and often that will stay there for 12 to 18 months, protecting the area, stopping the pooling of fluid, stopping the flies getting at it, and when that comes off, everything's beautifully healed underneath it. Is that a sort of approach you used in smaller wounds, perhaps, Dorianne?
Very definitely. Numerous smaller wounds. And we've also used the, I'm not sure of the technical term, but Pratley's putty, the marine one. We've actually also used that in terrapins, which seem to work quite nicely. But yeah, we do that all the time.
Yeah. What about you, Kevin? That your sort of approach?
Yeah, very similar. I think, looking at skin lesions such as this, it's, I guess, once you've reached that point of granulation tissue, which you would hope by about 12 weeks for most of the chelonians, maybe more like 6 in some of the lizards and snakes, then at least you've got to that point that infection is much less likely now, at which point you can cover that. I guess for me, if it's just granulation tissue and it's not bone or epidermis yet, I do have that slight little hesitation of, whatever I'm going to put on the surface might interfere with that, continuing that healing process. So for me, with some of these, I tend to be I guess it's still old school if you can still get them, Neil, but we used to use X-ray film and we take that over and then take the X-ray film, so you've got nothing actually contacting that surface. Whereas now we might put a Peri-oral or Micropore or something to cover that granulation tissue and then seal it in over the top with Technovit or dental acrylic or something, just so that that surface wound is not having, a product directly on top of it, because it's still healing. It's healing.
To be fair, I would normally put a hydrocolloidal dressing on, so I would have that in between the wound and the casting material. And you mentioned Technovit there, and I've always been cautious about that because it's so exothermic, and I prefer to use I'm trying to think of the name of it now, but it's a human dental acrylic. It'll come to me in a moment. But yeah, anyway, it's interesting. We're all basically doing much the same thing. Okay, thanks, Dorianne.
What I've done with when I'm putting a permanent cover over a defect is I've used the Opsite sticky dressing. I don't know if that's a product that you guys use. It's basically, it looks like cling film or DC Fix, and I've just stuck that over.
That's the Opsite FlexiGrid. Is that the one, Dorianne?
Yes, that one.
Yeah, that's fine. I mean, that's it. I can
basically
say
just to keep it off.
Yeah.
That works really nicely on this case that we're just coming to now. So talking about ventral burns, typically snakes that have either got a malfunctioning heat pad or they've wrapped themselves around a lamp or something of that type and got themselves burnt. And of course, as with all burn wounds, the great risk is infection. And so obviously F10 works really, really well for us there. But again, we would always say culture and sensitivity before you apply the F10. And then if it's a superficial wound, it's not doesn't go into the subepidermis, then you can use the ointment. If it does go deeper, then obviously F10 SC 1 in 250. And then just as Dorianne is saying, I would normally wrap it with the sticky Peri-oral, or if cost is an issue, just cling film and then tape at either end. But obviously the crucial thing is we've got to keep it clean, we've got to keep it moist, and snakes being snakes, they still want to wriggle around and do their own thing. So and it's not always terribly hygienic in their viv. So keeping it covered, but F10 is a great product to use. And of course, burn wounds tend to heal slowly, and because they're reptiles, they take even longer, and infection is a real major risk. So again, a wonderful application for F10. So just, we mentioned earlier on this issue about germicidal ointment as opposed to F10 SC, and just really to sort of think about this, and really it's going to have to be down to the individual clinician in the individual case, because it's a kind of swings and roundabout situation. The application of an ointment to a subepithelial wound will delay granulation and healing. However, it will control infection. And of course, in controlling the infection, that improves the rate of healing. So our advice would be, if you can access your patient often enough to spray with F10 SC 1 in 250 twice a day, or to use your wet-to-wet dressings wrapped up in Peri-oral cling film, that's the way to go. Alternatively, if the patient is in a zoo setting, or it's somewhere where the carer can only access it every 2 or 3 days, then that's going to be very difficult to achieve. And in that situation, you may say that actually the ointment is a better option just in terms of controlling the infection. But the important thing is to bear in the back of your mind, F10 SC 1 in 250 soaked swabs applied will be better if the defect is subepidermal. Okay.
I would add into that just some of the dressings that we would use on some of these, where we're trying to get them to last for longer because of intermittent repeat trips to the vet or whatever, but sometimes actually suture them in place as well. So that's the other option, is you could actually put a layer over the top of that, stitch that in place, whilst if you're debriding it under anaesthetic in the first instance, for example, and that might buy you a little bit more time of that staying in place before the next visit and the next time they see you.
need to. Okay, sorry about that. So the next slide is just about reptile contagious disease spread and so on. And we can see a boa constrictor here with a head tilt. It's almost certainly got paramyxovirus, although it could be Boyd disease. People talk about nervous signs with Boyd disease, but it doesn't actually happen all that often. But the point is still there. Both of those diseases are highly infectious, highly contagious, and are a real challenge to screen for in apparently healthy snakes that people buy in. And it's true to say that whilst the odd pet owner has one snake, the vast majority of serious hobbyists have tens of, if not hundreds of, different snakes, typically in one or two closed rooms, all housed in tubs, in racks, very close to each other. And so, we really would stress to you that in this situation, using F10 fogging within that room is really, really important. Obviously, speak to your own clinician, or you as the clinician, make sure you do your homework and advise on the most up-to-date method of quarantine process, and also screening within the quarantine period. If you're talking about Reptorinovirus, are you going to be taking pharyngeal swabs and blood samples? That would tend to be the advice now always. But it's just realizing that you've got a vast investment in terms of the value of these snakes nowadays, and just buying in another snake because it's a particular morph that you want or whatever may be putting your whole collection at a terrific risk. And I can say that as someone who I've been dealing with an ongoing clinical case where a client purchased snakes with Boyd disease and introduced them into his collection. And they were very sensible, and they screened everything and they removed everything that was positive, but they ended up culling some 30 snakes. And that was all because screening and infection control was not as good as it should have been. And I've been involved with a legal case that is now in its 5th year, involving the cost of the losses suffered by that owner. So it really is an important thing to get right. Okay, this is a subject which actually it always almost brings a tear to my eye and makes me go wobbly at the knees, because this is a real hooray, well done health and hygiene story. And I have to say, I think it's something that has not been spread, not been talked about, and most clinicians are not aware of. And yet the research that was done by scientists, Che Weldon is the guy who was involved in South Africa, did the research to prove the efficacy and the safety of F10 with reptile, with amphibia. So just to recap, Chytridiomycosis is the greatest global threat to amphibia population survival. Many species of amphibia are threatened, if not already extinct, because of this disease. So it's a skin fungal disease. It's transmitted from individual amphibia to others. It initially started because of the export of African clawed frogs, clawed toads for human pregnancy diagnosis the whole way across the world. And without anyone realizing, the fungal infection was spread across the world, and that way it then put many amphibia populations at risk. And what Che Weldon did was that he did some very good research. There's a peer-reviewed paper that you can look on Google Scholar and bring it up and have a look. In fact, if you contact Health and Hygiene, they'll give you a copy. But what he was able to show that is you can not only, it is safe for amphibia to put them in, for adult amphibia to put them in F10 SC at 1 in 3,000 for a 10-minute bath once a day for 9 days. So not only is that safe, but it eliminates chytridiomycosis from that individual frog. And tadpoles, you can use F10 SC at 1 in 10,000, so much more dilute, But you do that for 10 minutes, once a day for 9 minutes, and that again is not only safe for the tadpoles, but also eliminates Chytridiomycosis. So basically, here we have, and in fact, there is another bit to the test I haven't put up here. You can also treat the spawn. So all 3 life stages of Amphibia can be treated and cleansed of Chytridiomycosis using F10 safely and effectively. And I've actually used this process in a zoological collection that I was working with, where in fact some Amphibia had been introduced that we were doing swabs routinely on arrival, and that they tested positive for chytrid, and we were able to eliminate that not only from those individuals, but keep it out of the collection as a whole. So it really does work. Obviously, around the world, there are lots of ARCs being set up to save Amphibia from extinction. And of course, as Amphibia are taken into the ARC, they need to be sanitized. And here we have the answer. F10 does it, F10 is safe, and F10 is effective. Kevin, was that something you were aware of?
Yes, I think we've been using F10 on the amphibians as well for, I guess, general sort of, control of skin disease as well. So the fact it's effective against chytrid is actually obviously a godsend, really, because again, that's one of the things you want to cover when you're treating these anyway. So it's beautiful.
Yeah, and it's I think that for me the enormity of it is it's not just we can fix this patient and make it better. We can save species. That's the important thing. There are species of Amphibia being exterminated on a weekly basis because of Chytridiomycosis. And yet, if the people working in those situations knew about this research and applied F10, they could actually eliminate the disease, and they could be treating prophylactically Amphibia coming into the arcs to prevent the introduction of chytrid into those arcs. Anyway, we must go on. It's just one of my hobby horses. I think it's really, really important. Okay, so thinking about some other F10 applications to reptile cases, obviously, I'm sure everyone's aware that male reptiles have a cloacal sulcus. So going back from the cloaca caudally, they have a little pocket there in which they accommodate their hemipenes. And of course, it's a fairly dirty part of the body, and you can get a build up with feces and contaminated urine and urates and so on. You can get contamination, infection in there. You can get prolapse, hemipenes, and so on. So again, on the top we can see a water dragon that's actually got a prolapse hemipenes, and on the bottom we can see a gecko which has not only got infection around the cloaca, but it's actually going up into the ventral abdominal area and into the leg. Sadly for that one, it's all going to be too late. But the point is, if you've got infection in that part of the body, actually flushing the cloaca out 2 or 3 times a day with F10 is a fantastically effective method of controlling that infection. And then another handy little one, and this isn't about controlling infection, this is about keeping tissue moist. Dissecdesis, or shedding in reptiles, a lot of, particularly people like geckos, don't shed very well, and that's typically because people are keeping them in the house in a dry environment, and when they're shedding they need a microclimate. So we would normally put in an ice cream container upside down with a little door cut in the side, and then some sphagnum moss or wet gauze or something in there, so they had a microclimate, a micro environment with a high humidity climate, which will help them shed. But if you get presented with these reptiles, typically like this one here, you can see that some of the shed skin is actually caught on the toes, and that will tend to contract and then restrict the blood supply to the toes, and the toes will drop off with lots of blood supply. So if you actually get the owner, you can start it, but then get the owners to rub in some F10 Germicidal Barrier Ointment into that shed on the toes, get them to rub it in once every day, and typically after 48 hours you can then just take that shed away, because it just moistens it all and makes it nice and easy to get off without causing any trauma to the underlying tissue.
I would add, if I can,
yeah.
Boxes, we actually recommend you actually spray with F10 in those, because you're creating a high humid environment, lots of water in there.
Yeah.
If you want to try and keep the hygiene up, as it were, I guess, to stop secondary overgrowth, and if they're going to spend their time in there, we actually recommend you use the F10 for keeping that moist and damp because of the environment you're intending to create. So it's a good one to add there.
Very, very good point. I'm just wondering here, I don't know whether Corné can just help us. We should have been having some polling questions in this presentation. I'm not sure what went wrong.
Hi, Neil. The polling questions have been running on the side. I actually did send you a private message. So they've been running on the side, and people have been answering them as they come up after the slide. So we can maybe have a discussion at the end of the presentation.
Okay, all right. We'll run through those because I think it's useful to discuss them. So just key choice points for F10. The great thing from our point of view, it's safety to the patient and the user. There's testing on the end product by accredited externally quality controlled laboratories. There's efficacy tested by independent accredited quality controlled laboratories, and those test certificates are made available to clinicians and end users. There's also environmental safety tests, again by accredited quality control laboratories. And the lack of metal corrosion and the inhalation safety means that F10, unlike almost all other products, is safe to use by fogging. F10 is produced by Health and Hygiene, which is an ethical, evidence-based quality manufacturer, and they're assessed for the quality of their manufacturing process, and every time it hits the top level of performance on all the tests, which is very reassuring. There's added value to all products by education, by training, and by the provision of the application instructions, safety and efficacy data certificates. Treatment products are obviously a great way for clinicians to gain confidence with individual pet owners, but treatment of individual patients is one thing, but as I've stressed several times through this evening, is really controlling infection, controlling before it happens, sanitizing the air, sanitizing the Bavaria, limiting spread of contagious infection is really so important. So I think probably, Corné, can we just go back to those polling questions and just go through each one at a time? Are they all on the chats? If we go back, or?
Yes, they are on the chats. In the poll section. You can just click on poll.
So all right. So can everyone see those? So I'm just going to go through each of the polls one by one. So for this question we were meaning to give right at the beginning of the presentation, and which statement is most correct in respect of creation of a biosecurity control process? And you're going to have to choose what one or the one of these that is most correct. F10 is such a wonderful, safe and effective disinfectant that simply applying F10 at all stages of admission, treatment and discharge will control any risk. That's answer A. Answer B, biosecurity control should involve a structured written process which all staff members adhere to. Oh, hang on. I'm sorry, the poll's jumping around.
Yes, because people are voting.
I think, is that the first one we're on now, Corné?
Yes, the one regarding biosecurity control process.
Okay, all right. So forget what I was saying before. We'll start with this first one. Which statement is most true in respect of zoonotic infections in herp patients? A, zoonotic infections from herp patients are rare. Standard hygiene measures are sufficient. B, herp patients commonly carry a number of zoonotic infections. They should not be handled by immune-compromised carers, nor should they be kept in a bedroom or a food preparation area. Good hygiene. There's obviously more that isn't fitting on there. I'm sorry about that. C, F10 fogging to prevent herp zoonotic disease is of limited value, as most infections tend to be fomite rather than airborne spread. D, when you clean out herp enclosures, wiping down all surfaces with F10 1 in 250 is an effective method of ensuring infection control and biosecurity. Or E, snake mites can be involved in the spread of snake disease, such as retrovirus. To control this, all snakes should be liberally sprayed with F10 germicidal spray with insecticide. So if everyone can vote now, and then we'll just go through those questions, and Kevin, Dorianne, and I can chip in and give you our thoughts. Okay. So looking at the answers here, we only had 35 people actually voted. Okay, so just looking at that one that we had the question on the zoonotic infections. 64% of people said herp patients commonly carry a number of zoonotic infections. They should not be handled by immune-compromised carers, nor should they be kept in a bedroom food preparation area, and good hygiene is essential. And that is really a very good answer. And I think all of us here, we'll get everyone else's input in a minute, but I think that really is the one to go for. Option D, when you clean out herp enclosures, wiping down all surfaces with F10 SC 1 in 250 is an effective method of ensuring infection control and biosecurity. Well, in all honesty, it doesn't do everything. It won't control airborne spread, and it won't control fomite spread, and it won't control spread by ectoparasites. So that alone is actually not enough. Zoonotic infections from herp patients are rare. That's obviously untrue. We know there's a lot of those. And fogging to prevent herp zoonotic disease is of limited value, as most tend to be fomite rather than airborne spread. And whilst that may be true for many diseases, it's not true for all of them. And the other answer is a much better answer. Any comments there, Dorianne or Kevin? No? Okay, all right. So we'll move on from that one. So let's tackle this one here about Reptor arenavirus. Answer A, Reptor arenavirus is a rare snake virus of minimal clinical significance. Answer B, Reptor arenavirus is readily diagnosed pre-purchase in affected snakes. Answer C, snakes infected with Reptor arenavirus always show clinical signs of illness, so avoiding the introduction of infected snakes in the collection is easily achieved. D, a quarantine period of 1 to 3 months is recommended after purchasing a new snake. If contagious disease is present, it will always become overt in that period. Or E, incubation and subclinical periods of Reptor arenavirus in snakes can be extremely long. 6 months quarantine with swab and blood testing will detect most but not all cases of snake Reptor arenavirus. Okay, so we got some good voting there. And we got 75% of people saying answer E, which is that incubation period is very long, and snakes often have subclinical infection. And in fact, if they are infected with Reptor arenavirus, some of them actually never develop clinical signs, but of course will carry the virus and potentially spread it on. So I think that's straightforward. Any of you, Kevin or Dorianne, have you got experience of dealing with outbreaks of Reptor arenavirus? So you got anything to share with us here?
Dorianne, a question in the chat, I think, about how long we'd be recommending quarantine for reptile species. And I think that's an interesting point because, when you're looking at infectious diseases, you are looking at 3 to 6 months as almost as a minimum guidance, I think, Neil, for these. And as you said, you still can't guarantee after that. You do find, I guess, there is an element here of practicality too, isn't it? Because the longer the quarantine periods you recommend, the more impractical it becomes and the less likely you're going to get compliance from your owners or from people that have collections. And I remember one of my clients, this is actually one of my avian clients from years ago, who was concerned about avian bornavirius as it happened. But what he used to do, he actually used to quarantine his birds, and I recommend the same for the reptiles, obviously, now as well. He quarantined them completely separate. But of course, if it was a particularly valuable morph or valuable bird or whatever that you're desperate to breed with, what you don't want to do is to spend a lot of money on getting an exciting morph in and then quarantine it for like 12 years and just do nothing with it. That's crazy. So my recommendation for those people that are kicking back about quarantine length is, if the value of your collection is so great, you can't risk introduction. But if the value of the one you've just purchased is also very great and you need to get on and, I guess, get some money back from your investment, perhaps, then for me, it's like, then you take an animal out of your collection and it goes into quarantine with that animal for breeding purposes, and all the offspring obviously stay in quarantine too. So you can actually, if you're prepared to jiggle around your quarantine a bit, get away with extended quarantine without necessarily impacting on the reproductive performance for people breeding telomorphs for the commercial market, maybe.
Great, thanks. So Dorianne, are there many hobbyists collecting different colour morphs and breeding them, and what do they do about biosecurity in South Africa?
The ball python market is absolutely enormous with all the different morphs.
Yeah.
And yeah, we have a large number of hobbyists, some of them with some very valuable animals. And I'm embarrassed to say that the vast majority of them hardly quarantine at all.
Yeah.
It's something that we're trying to work with, and I've had several collections be absolutely decimated by viral diseases.
Absolutely.
But you know, it's often in those situations, it's a case of closing the stable door after the horse is gone. You know.
Sure.
Sure.
But I think you're right.
Education.
It is our responsibility to talk to breeders, to write articles in magazines, and all the rest of it, because, you know, someone has to stand up, for the individuals, and talk about what quarantine should be done, what testing should be done, the use of good cleaning and disinfection and biosecurity processes, and having a written procedure how they do it, I think is really important. Okay, let's go on to the next poll. So which statement is most correct in respect of creation of a biosecurity process? A, F10 is such a wonderful, safe and effective disinfectant that simply applying F10 at all stages of admission, treatment and discharge will control all risks. B, biosecurity control should involve a structured, written process which all staff members adhere to in order to minimize the introduction of pathogens, the management of staff, animals and fomites. C, correct choice of disinfectant to use within your biosecurity process is essential. This is best decided based on cost, color, scent, and how much you like the representative. Sounds like a good option to me. Biosecurity is overrated in these days of antimicrobials, antiviral, antibiotic, antifungal agents. They can be used to control patient infections that might arise. Or E, when choosing an effective disinfectant, you can rely on data and information provided to you by the sales representative. So if I can ask everyone who hasn't already voted to cast their vote at this point. Okay. Oh, gosh, people have done well here. Yeah, so 88% saying biosecurity control should involve a structured written process which all staff members adhere to in order to minimize the introduction of pathogens, the management of staff, animals and fomites, which is a great answer, I think. Okay, so let's just see. I think we might just have one more. Okay, which one statement is most accurate in respect to the use of F10 products in reptiles and amphibia with skin wounds? A, herp patients are poikilothermic. As such, dermal, bacterial and fungal infections are rare. Wounds tend to heal well and neither topical or systemic therapy is indicated. B, all cutaneous and percutaneous wounds in herp patients can be suitably and effectively treated with F10 Germicidal Barrier Cream. C, superficial wounds and infections can be treated with F10 Germicidal Barrier Cream but percutaneous lesions should instead ideally be treated with F10 SC 1 in 250 in saline, flushes twice a day. And there's something more there. Twice a day. Systemic therapy for deeper wounds is also indicated subsequent to culture and sensitivity. D, Pseudomonas species and Aeromonas contamination of herp cutaneous wounds is common. F10 has limited activity against these, and an alcohol-based iodine disinfectant would be more appropriate. Or E, if herps are affected by dermal lesions, it is best to reduce their environmental temperature to their minimum recommended preferred optimum temperature zone in the hope of stimulating disecdesis, as when they shed the skin, when they shed the lesions will be replaced with healthy skin. So if you can, if you haven't already answered that one, if you can answer that one, that would be great. So looking at the answers we have for that answer, I'm pleased to say that, pleased to see that answer C, superficial wounds and infections can be treated with F10 Germicidal Barrier Cream, but percutaneous lesions, you should be using F10 SC 1 in 250 in saline, flushes twice a day, and systemic antibiotics subject to culture and sensitivity. That's a good answer there. Okay, so I think we've probably just got one question left. And for this one, you answer every question that you believe is correct. Actually, we got two. Well, we got two. So we'll do the one that you answer everyone that's correct. A, I'm aware of F10 and use at least one product. B, I only use F10 products for cleaning and biosecurity. C, I use F10 products for disinfection and also for patient treatments. Or D, I wasn't aware that F10 products were licensed for patient treatment. And E, I use F10 by fogging on a regular routine basis. So you can answer as many of these as are appropriate. Okay, so the answers we have is 35% of people use F10 for disinfection and treatment. That's good. 31% also, I'm aware of F10 and use at least one product. Well, the 36%, that's bizarre because everyone who answered C should have answered A as well, but not to worry. Using fogging on a regular basis, only 19%. So I think we can do some improvement on that after tonight's lecture, I hope. 11% only using F10 for cleaning and biosecurity. So hopefully you got some stuff to take home with you tonight. And 2% weren't aware that you could use F10 for patient treatment. Okay, and so this really is the last question. So which one statement is most accurate in respect of Chelonia Herpes Virus? So A, this viral disease only affects Chelonia from temperate climate zones. Equatorial Chelonia are not affected. B, Chelonia Herpes Virus is only a disease of neonatal individuals. Mixing a group of mature Chelonia, even of different species, does not create a risk. C, different Chelonia species have different susceptibility and carrier status prevalence. As such, different species should never be housed together. D, Chelonia herpes virus is a very low prevalence in ranch or captive bred Chelonia hatchlings. Or E, Chelonia herpes virus is readily treated and cleared up from clinical patient cases with a 7-day course of a cyclovar. So if you haven't already voted, if you can vote just one answer, the most correct answer here, that would be great. Okay, and I'm delighted to see that 91% of people have said different Chelonia species have different susceptibility and carrier status prevalence, and as such, different species should never be housed together. Good take-home message. So well done, everybody. So at that point, I would like to just draw things to a close by asking Dorianne and Kevin. Let's start with Dorianne. For you, Dorianne, what is the F10 case or application that you've used in your career that you think has made the biggest impression on you?
You know, you prepared me for this, but I was thinking, and there are so many.
Yeah,
there are so many. Everything from nebulizing with F10, especially for fungal infections, absolute winner. Your nasty chronic burn wounds. There's so many.
If you're asking me, I give a very similar answer to Dorianne, actually, in that there are, it's a product that I've used for so long. It pretty much has become routine, isn't it? It's that sort of thing where you would use it as fairly standard, and you can see some very impressive results in reptiles that you think, they're very good at surviving things that perhaps you wouldn't expect otherwise. But, F10 as part of this treatment obviously helps. So it is something that's used routinely in our clinic. I don't think I ever sort of got to a sort of an epiphany moment where it's like I wasn't using F10 and then went, oh my God, this actually works, and started using it. It's just been, I guess, part of what I've done over the years, and obviously my enthusiasm for using it's increased. And we nebulize everything with F10 these days as fairly standard in a variety of circumstances. Eye disease, I think that was a brilliant thing, Neil, for conjunctival mycosis. I think that's brilliant, and it's certainly, I think you've got things then to look at. Great for that, and like I say, nebulizing or spraying in the eye is the other option that we might want sometimes do as well. So I think there's lots of things there, and that's quite an interesting one, because a lot of people that can't actually physically capture or handle their birds or reptiles, spraying in the face directly or even nebulizing in a little cat carrier, you're going to have an effect against conjunctivitis too, and that's a really nice thing to take home from today for me.
When we were talking about some of the treatment applications, for example, respiratory disease and so on, I think the other point to make here is that, of course, F10 fogging can be very easily done, or nebulization can be done at home by the owner. And, bearing in mind that so many reptiles are sick for so long because it takes them so long to respond, that actually if they were having to be hospitalized for the whole of that period, that would create additional risk of contagious infection to other inpatients. The costs would become unrealistic. I know Dorianne would have them all there as a favor and not worry about the cost, but but for those of us who have clinics owned by corporate bodies where we have to charge the right fee, the cost would be prohibitive. And yet, because we can actually let the patient go home and be nebulized with F10, there may well be other treatment going on as well. It really is a big saving grace. I mean, yes, you put a pharyngostomy tube in and they can give some medication by mouth. But for me, nowadays, I think one of the big things for me with reptile patients is make a good diagnosis, get them on the right treatment, put a pharyngostomy tube in so that the owner can give the medication and the nutrition and the fluid by mouth and get them home. Because by definition, a hospital is an infected, dirty place where they are at risk of infection and they're at risk of giving other people infection. And the sooner we can get them out of the place, the better. And F10 certainly is one factor that makes that very much easier.
You made one thing, Neil, I'd add to your plan: send them home as soon as they've corrected the husbandry.
Very good. Very good point. Yes, and don't take anything for granted. When I'm lecturing to vets, one of the key things I say to people is, for heaven's sake, ask the right question. If you say, when the owner comes in for that consult at the beginning and you say, oh, and what temperature have you got the Viv at? And they rattle off, oh, it's 32 degrees at the hot end and 24 at the cool end, and I don't let it drop below 22 at night. And then you say to them, do you have a thermometer in the Bavaria? No. I said, well, how do you notice that? Well, I set it up with a thermostat when I first got them 10 years ago, and I've never changed it, so it must still be okay. So ask the right questions. The first question is, do you have a thermometer? Then you can ask the question of what is it? Because they will tell you what they think you want to know, not necessarily what the truth is. And it on occasions as clinicians we have to be detectives to actually just get some honest truth.
And depending on your nationality or location, I spend a lot of my time trying to teach owners how their central heating works and how it doesn't hold room temperature overnight.
Yeah.
Because that's not how it works. So I always ask my clients, what's the temperature at 3 o'clock in the morning in July? What's the temperature at 3 o'clock in the morning in January? And how do you know? Because your heating sources at some point are going to fail. I'm in Scotland, so we obviously have a different climate to a lot of people on the.
Indeed.
But
you can see the snow outside the window now, can't you, Kevin?
Well, it's Everlasting County, but it's not snowing.
That's a bonus.
Right. Yeah, I think we've got better weather than the south of the UK at the minute, actually, probably.
No, we got bright sunshine. But those of you in South Africa, of course, we are not in winter now. We're in the middle of the summer. So hence the joke. I know in South Africa it's pretty chilly at the moment. It's probably down below 30 for all I know. Anyway, just to finish off now, two things to say. Firstly, thank you all the delegates. Well, and any questions? That's the first thing. And any questions from anyone?
Yes, there's a couple of questions in the questions tab, Dr. Neil. If you could maybe just click on the questions tab. There is about 5 questions for our panelists.
Okay, so starting off with the first one with Shurat, what is the contact time, what dilution for nebulizing and for ophthalmic drops? Okay, well, for nebulizing, we'll be using 1 in 250 dilution in saline. The contact time, and if you're nebulizing, we're going to run it for 30 minutes 3 times a day, generally is what we would do. So that would give you sufficient contact time. And ophthalmic drops, I would normally use a more dilute solution. I would use a 1 in 500 in saline dilution, and I literally put 2 drops in the eye. Depends on the size of the eye, of course. The little tortoise would only have 1 drop, but I would put a drop or 2 in the eye twice a day and do it for 5 days, and I've never seen any problems, and I've had some fantastic successes. Any other comments, Kevin, Dorianne? Okay, so next one is from Mohammed. Which F10 product can be used for applying as a foam? Can we use F10 CL General Farm Disinfectant for foaming? Now, I know that there was, I think we'll have to come back to you with the answer to that one. There was an F10 foam product at one point. I'm not aware that it's still available now. Why? And the other question, Mohammed, why would you want to use a foaming product? I'm not quite sure what the relevance of that is. And the second part of the question, whether the efficacy of F10 products is affected if there is organic matter after the application, does it work in the presence of organic matter? And it's really important to say that cleaning has to be a 2-step process. And I'm still amazed how many people confuse cleaning and disinfection. So first step is you've got to clean the surface with warm soapy water and a brush and elbow grease if you need to. And then when you've got rid of the organic material, you use your F10 product at the right concentration for the right contact time. So there aren't any disinfectants that will be effective with organic material. So it really is important for everyone to understand, clean first and then disinfect.
I would add, if I can, Neil, that I think there is a logic in using F10 during cleaning prior to using F10 for disinfection, for the simple reason, if you're cleaning and scrubbing, you're going to be creating infectious aerosols by the nature of what you're doing. So if you do have a product, because you do have the F10 with a detergent too, don't you, if I recall? Is that still a product?
Yes, F10 XD.
So with that, at least then you're neutralizing any aerosolized particles as you're cleaning, and then once it's clean, then you can do that. And certainly from any of these things, if you're cleaning out a cage or a tray and you're going to create a lot of dust in the environment, if you're misting that with something to dampen that down, and that's going to control infection being splashed up in your face or into the environment of the setup. So there is a logic of cleaning with the detergent and the disinfectant before you then disinfect with the appropriate concentration, the appropriate contact time.
Yeah, excellent. Good. And then Wadar is saying, when can we have the file up? And that will be up, I believe, tomorrow morning. And that has the simultaneous translation when it's on the YouTube. And then I think next question, can F10SC be used in lovebird eye disease and how to use? Well, I think any of us would say, hang on a minute, you've got to diagnose what your eye disease is. And I would certainly always be wanting to take a swab. In a bird with eye disease, I would always want to do a chlamydia test, because ophthalmic disease is a common clinical presentation of chlamydia. And of course, if it is chlamydia, putting F10 drops in the eye is not going to solve the problem. So, I think back to basics, make a diagnosis. But if it is just a conjunctivitis, whether it's bacterial or fungal, yes, F10SC, diluted in saline at 1 in 500. And just one other thing about diluting for flushing sinuses and for putting in eyes and so on, I really would urge any clinicians, don't give out a bottle of concentrated F10. Dilute it in saline and give that out, because I have had one case where an owner flushed the sinuses in a parakeet with F10SC concentrate, and that wasn't a good thing to do and was just stupid. And just
two things that if I can here, I've had with people nebulizing with F10SC and not diluting it. And lovebird eye disease, it might actually be they're more concerned about pox here because it's lovebird specifically, so it might be a good pox.
Sure.
Just that's on the side for the thingy.
Yeah. Good point. Okay. Just so there was one thing that came up before. Oh no, I've forgotten it now. The moment's passed. It'll probably come back to me in a minute. Okay, Karen, I saw you were here. Lovely to have you with us. We often get tortoises in from welfare confiscations. We do keep them in quarantine, but with you mentioning fogging them, can we then fog them on arrival? Absolutely. Could this be done in a closed box, large plastic container? Absolutely. Or each individual separately. If you've got a number of tortoises coming from the same place, yes, fog them all together. If you've got a room which is a tortoise ward, yes, you can fog the whole room, absolutely. But if you've got an individual clinically affected tortoise or one that's coming in by itself, we would always recommend keeping that separate from the others and being treated individually. Any other comments from anyone there?
I would add for this one, I'm assuming these tortoises are all going to be bathed as soon as they arrive as well, because they're going to be probably lacking hydration, etc., etc. There's nothing to stop you putting F10 in that bath when you're bathing these guys upon arrival as well, which is obviously going to help complement the fogging.
Yeah, good point. Thank you. Good, nice one. Okay, so two last things for me to do. Three. One is to thank all our delegates for joining us. For me, it's been a fantastic pleasure talking with Kevin and Dorianne. I stop and drop into Dorianne's clinic and we talk about cases and treatments, and I chat to Kevin from time to time. But actually, all of us being together is nice, and we ought to do this properly, face to face with some beers, I think, or nice South African wine at some point. So that's a plan. Great having you two guys. Thank you very much indeed. Thank you, delegates, for joining us. And just to bring to everyone's attention, the last slide in the presentation there is just to remind you that on August the 3rd, we have our next of these series of webinars. So Tuesday, August the 3rd, when we're covering small mammals, small exotic mammals, and that will be myself and Dr. Molly Varga, who's a Royal College of Veterinary Surgeons, specialist in exotic small mammals, and also a specialist in zoological medicine. So I'm really looking forward to having a chat with Molly on that occasion, and we would really enjoy your company, all of you, again then, and hopefully can share some new and different things with you. So thank you to all the delegates, and thank you very much indeed to Kevin and to Dorianne, and thank you to Cornet for organising it, and Linda for making it all happen. Thanks, everybody.
It was a pleasure. Thank you.
Thanks, guys.
There are some references at the end of this presentation you can all have a look at if you want to do some more reading as well. Thank you all, everybody. And this presentation will be up in a day or two on the YouTube channel. So if you want to go through it again or share it with your colleagues when you get home, or your clients, no reason why they can't have it as well. Those people you've been struggling to get them to use F10 to control contagious infection, then do please let them have access. It's all out in the public arena for the benefit of animals and for educating owners, clinicians, and vendors alike. Thank you, everybody. Good night.